Closing today's program is Dr. Santhosshi Narayanan, a pioneering voice in integrative oncology in the US. She is a clinical associate professor at the Integrative Medicine Center at MD Anderson Cancer Center, a former board member of the Society of Integrative Oncology and the American College of Physicians, and led clinical trials on meditation and medicinal mushrooms, earning multiple awards. Dr. Narayanan, the audience is all yours.
Well, thank you so much for the kind introduction. It is wonderful to see everyone here. I would like to start my talk by thanking Mr. Thomas Pfeiffer for having us all here in one place together. And I know that time is very critical today, so we will try to be within 15 minutes. And you're all excited to do the next event, the evening. But I would like to talk with you all for 1 to 2 minutes. So yes, how is everyone feeling today? How are you all feeling today? Good? And what is the kind of energy you're feeling in this conference today? Amazing. Amazing, right? Amazing. So it is amazing. You feel love, you feel healing, you feel learning. There is a lot of different energies, right? So some are logical, like learning, and some are not very logical, like healing, right? You can only feel it, right? So the reason I bring this out is the nature of life. Life is mystical and logical. So there is like a beautiful components of life. And same thing in integrative medicine. So you have different spectrum of people. Some are very logical to the molecular level where we do targeted therapy, right, for cancer. And some are very mystical, like healing, and how do I get this better? Indigenous medicine, there's so many things, right? But there is a common ground, and that is integrative medicine. So I'm Santhosshi, and what I do is I practice integrative oncology at MD Anderson Cancer Center. That's our cancer center there. And our MD Anderson is considered world's #1 cancer center. And I'm saying this not out of a sense of pride, but the reason I'm saying that is I'm humbled to work there, and I see this, the integrative medicine, come true every day. I practice integrative medicine 100%. Each and every patient I see, we do integrative oncology. So this is happening. It is going to be the future for every person. Not just people with cancer, but for every person, integrative medicine should touch their lives. So I don't have any conflict of interest for my talk today. I serve as a board member, and I will be joining executive committee for Society of Integrative Oncology. It's no financial conflict of interest, but I'll have a couple of slides about SIO. So the learning objectives, what I want you all to get from this talk is, #1, to learn the differences between alternative versus complementary versus integrative medicine and define integrative oncology. So my friend Dr. Massimo Bonucci already did this, but I'm going to repeat it once more so that we never forget it, right, even in our sleep. Second is I'm going to describe what do we do, what does my practice look like at MD Anderson Cancer Center. And third, I'm going to explain the guidelines. So Dr. Goswami just presented a couple of speakers before. He said how it's important to have the evidence because we need these two to talk. As we know, CAM is very frequently used, but every cancer patient goes to the oncologist also, correct? So we don't want them to get mixed messages, because as a patient, when you're going through something so stressful as cancer, the last thing you want is two people telling you bad things about each other. So we want this togetherness. So I will talk about guidelines to bring these two dimensions together. And 4 is I will highlight some real-world practice patterns. So integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind-body practices, natural products, and lifestyle modifications from different traditions alongside conventional cancer therapy. So I want you all to note the word alongside. And it aims to, of course, optimize health, which is very important. We talked about the conventional medicine where the health, more than health, other things like like one treatment, one outcome, one molecule is emphasized. So this is whole health, quality of life, and clinical outcomes across the cancer care continuum. So the difference is that in alternative medicine, you use it in place of conventional medicine. And this often may not be ideal for most people, because there may be something very, very nice treatment in conventional medicine. And if you completely give up that and do only alternative medicine, it may not be the best interest of that particular patient. And complementary medicine is used together. And what we want people to do, cancer patients to do, is CIM, complementary and integrative medicine. Integrate both together. So the reason I have this slide is because this is one of the papers we published, and you can see this is Nature Reviews. So this shows the interest in integrative oncology from Nature Reviews, which has impact factor of 63.5 or 65. It's one of a very, very good journal to publish in, and they are interested. This was an invited article. They're interested in integrative medicine. So this shows that conventional world is also interested in this. So there is no division. And you can see, and we summarize this table based on guidelines, based on NCCN guidelines, ASCO-SIO guidelines, and we see that there are different modalities: acupuncture, massage, yoga, tai chi, hypnosis, music, nutrition, exercise, for different symptoms, and so much of guidelines are available already. And this is important when we are communicating with our conventional oncology colleagues to talk about the guidelines, so that we are not seen that we are doing something like a lot of you said, like you're seen as a witch doctor and things like that. It's okay, nobody cares, but still it would be nice to make sure that they understand that there are guidelines which exist for these ones. So the real world practice pattern, this is our team. So we have yoga therapists, music therapists, we have mind-body hypnosis therapists, researchers, we have nutritionists, physical therapists, health psychologists. So we have different kind of providers in our team, and we all work together for our patients. And this is our model. We focus on the physical aspects of one's health. So every patient gets counseling on nutrition, exercise, acupuncture, massage. We talk about mind and body in every patient's care. Health psychology is involved appropriately, even for weight loss. We have weight loss programs through psychology because we have to work through the mind, even though people know diet and exercise are the key. And music therapy, Tai Chi, yoga, and we have group programs. We have social support groups and group yoga, group music, cooking classes, and things like that. So this is how we assess each patient. So when a patient walks into one of our clinic doors, we also do virtual clinic. So when we see a patient virtually or in person, the patient fills out these things. So this is like our X-ray. So number one, what is the concern? What is your top 2 concern? Right? So often in oncology practice, the top 2 concerns may be different compared to what really this patient is feeling. So in oncology practice, the concern is how do we control the cancer, which is very important, right? But in integrative practice, our concern is how's your pain? How is the stress? How are you dealing with fatigue from treatments, right? So the top concerns, and then we have the symptoms. So we ask people to rate their symptoms by ESAS on a scale of 0 to 10, which is a very simple scoring system, and we have this number. And we have other quality of life questionnaires and things like that. We measure this for both clinical aspects, and also we do research and find out how we can help the patient. So we are 5 physicians, and every patient we go through this. We do a detailed evaluation, and we talk about diet, exercise, mood, stress, sleep, and symptom management for every single cancer patient that we see. And then we also refer them to nutrition, physical therapy, psychology, acupuncture, massage. There's also yoga therapy, music therapy. So we refer them to all kinds of providers within our team. So this is another paper that we published, and it shows that symptom management is one of the main concerns for cancer patients, right? So people care about their symptoms. They want to get better. And the patient concerns, what we find is that if you look at the top 3, what patients want and what oncologists want is actually the same. So diet, pain, and integrative or holistic approach are the top 3 reasons why our patients are seeing us. And then we look at the oncology. So we have 2,000 faculty in our center. So it includes research faculty and clinical faculty, and they refer patients to us, oncologists and other providers like supportive care. So when you look at their concerns, integrative approach, which is holistic approach, diet and pain. So we all have the same concerns. The patients, the oncologists, integrative oncologists, we all want to make the patient feel better, which is great. And these are integrative interventions we do, birth symptom. Of course, we don't want to look too much into the numbers, but big picture of things. We use acupuncture for fatigue, nausea, neuropathy, hot flashes, pain, dry mouth, oncology massage. So we published this paper. When we publish, we look at 2017 data, because this was before guidelines, and when the guidelines came, our practice and the guidelines actually matched, which is good. And this is a guideline, NCCN Clinical Practice Guidelines on Oncology, and all of these symptoms, cancer pain, nausea, fatigue, distress management, survivorship, all these guidelines include integrative therapy. That is a big success for the field, because with guidelines, we can bring everyone together and be on the same page for the sake of our patient. We have to do this. And again, SIO, ASCO guidelines. Massimo already presented about SIO. SIO is an international organization. We have a lot of members from Europe. We have a global committee, which I and Max work together and co-chaired, and now Nina is the chair. And now we have the Ayurveda SIG too. So we realized that Ayurveda was not represented. So I founded the SIG, and now it is going very well. So we discuss, we meet every month, and here we are doing a hot water toast for the success of the SIG when we met last year. This is our SIG team. And it includes people from all different countries, Australia, US, India, and many other countries. So guideline development. Why is SIO important? SIO is working with ASCO, American Society of Clinical Oncology, and there are several guidelines, because we have ASCO guidelines, which is what oncologists recognize as a standard of care. So when we have an SIO-ASCO combined guidelines, that gives credibility. When we practice alongside oncologists, our oncologists can feel confident to send their patient to us. I am not going to prescribe a supplement just like that without knowing about it, learning about it, and knowing the interaction, side effects, and without thinking about the patient's best interest. So a lot of supplements are great. They're derived from nature, but they also have interaction, which we'll talk about. So this is a sample. We have only 4 minutes, so I'll go over very quickly. This is a sample guideline. This is for pain. You can see acupuncture, massage, hypnosis. So there is a very detailed evaluation of all the studies in the field, not just RCT, because to conduct an RCT, we need a lot of money. And in integrative medicine, you're not going to find that much of money to conduct an RCT, because there is no pharma support. That's where we need to work together to supplement companies, and hopefully in the future, there will be studies that can be done by the supplement company like more, and it will be done in a very rigorous scientific way so that we can bring this together. And this is pain guidelines. And then we have massage, yoga, imagery, acupuncture, reflexology, and music therapy. And then we have NCCN guidelines for cancer-related fatigue. And what do we actually tell the patients? Our integrative approach, as we already spoke about, has 5 components: diet, exercise, mood, stress, sleep, and symptoms. So diet, we follow AICR. Basically, you want to take care of the gut microbiome. Of course, Ayurveda is very big in it, and we asked people to increase more fiber, and we all know that gut microbiome, serotonin, the mood, everything is connected. So we want to encourage more vegetables, more beans, lentils, and things like that. And if you look at cruciferous vegetables, I3C, protects against breast cancer. So we encourage the use of eating cruciferous vegetable. Again, exercise. Exercise also is a prescription. We prescribe exercise. We tell patients what to do. Sometimes there is like a metastatic disease, like there is spots of cancer in the bone, metastatic bone disease. We should know what to tell the patient, whether to exercise or not, how much to do. We use other resources, physical therapy, neurologists. If they have neuropathy, there is a risk of fall. So we have to take care of exercise and help the people to do exercise. Simply telling them just exercise is not enough. And how many of you feel like this? Stress is killing you, need an easier job, smaller house, and a different family. Anybody feel like this? It's normal for somebody dealing with cancer to feel like this, with all the side effects, with the hormone changes, and so many things. So taking care of the patient's stress is important, because you can see here, microscopically, for those of you who think very logically, it says that it can affect the cancer cell. The blue is cancer cell. You can see DNA repair inhibition, oncogene activation, right? Both places, stress has a role. So it is very adverse to cancer, and you tell a cancer patient, don't be stressed. That's the Hard thing to do, right? So you give them the tools. You give mind-body therapies. There is music, there is yoga, and we have only a couple of minutes, so I'll show some studies that we have done. We have a music therapist, we have yoga therapy, which shows the blue and the orange that the symptom reduction, the symptom burden is reduced with yoga therapy. Again, publications of acupuncture for sleep. Sleep is another important aspect. One day, if we don't sleep, our immunity goes down. So we need to take care of the sleep. We need to use acupuncture. Studies are showing acupuncture helps pain, nausea, dry mouth, hot flashes, fatigue. So many people give up their treatment because of these symptoms. You add acupuncture, people are more comfortable. Massage therapy for so many symptoms, herbs and supplements. So a lot of people were asking me about mushroom supplements, so I got so intrigued by it because I believe that there is a response. So I did this systematic review, reviewed about 10 years worth of papers, more than 3,500, found that 31 out of 39 studies showed beneficial effect and positive immunological response. But at the same time, we need to be careful with interaction. We need to be careful with which mushroom for which patients. Sometimes some people are on warfarin. Certain mushrooms interact with warfarin. We need to be careful with that. So the patient selection, right dosing, and which mushroom for which cancer, and the interaction with their treatment, all of this needs to be taken into consideration. So we support the use, but we have to counsel the patient appropriately. Again, antioxidants is another concern. There is a concern that antioxidants can be very protective to the cancer cells and normal cells. So in this one study, 540 head and neck cancer patients, it showed that people actually felt better when they did beta-carotene and vitamin E, which is antioxidant, but it increases the local recurrence of cancer. That shows that there is a protective effect on the cancer too. So we need to be cautious on which patient are we using, which ones. So again, Ayurveda, you heard a lot about Ayurveda, so because of interest of time, I did not include a lot of slides, but Ayurveda is also incorporated in our practice in a different way. So we have a patient who wanted Ayurvedic consultation, so we incorporated diet, and then we incorporated some herbs that he can use in his diet. And when it came to supplement, there was a lot of back and forth because the patient had chemotherapy, so we had to be extremely cautious. But we were able to facilitate a joint integrative oncology and Ayurveda consultation where I was there, I had the patient, and I had an Ayurveda consultant, and all three of us were talking to the patient, and we were making decisions together. So that type of integration is the key for the future. So this is another table that we were talking. So these kind of conferences are very important to bring all of us together, right? Because we learn from each other. Then we see what is the problem that we have to solve. What is cancer patients' needs? We saw that there's no guide to people on what to do. So we met in one of these conferences, and three of us just put together like how we are doing here. We are talking to each other, and we classified with risk versus benefit, and we just put a paper and this table together very quickly, and it shows that minimal risk, minimal benefits, then counsel. If the risk is high, of course, avoid. If the risk is low, of course, consider counsel. But counseling is very, very important for patients. These are some of the herb and supplement resources that we advise for the patients to go and check the quality of supplements, because we also want to protect the patient. We want the patient to only take good quality supplements, right? And not take something which is sold in a bottle with no label and call the supplement, but it may be something like contaminants. So what is the key takeaway? The key takeaway is that integrative medicine involves approaching a patient as a whole. The person's physical aspects, emotional health aspects. You see the person as a human, a person with cancer, and it's not like a cancer patient, even though it's commonly used. Number two, use mind-body approaches, use dietary interventions, use yoga, tai chi. Talk about music, right? Like what music does the patient like? How? And we saw in the conference, like what is the effect of music on us? You feel it, right? You feel like a tingling, you feel the power of the music on you. So talk about it with the patient. Acupuncture, oncology, massage can be safely integrated. There is a lot of data. So if your oncologist or your conventional physicians are uncomfortable, talk to them about the data, talk to them about the guideline, which we just reviewed. And herbs and supplements, it's our duty to protect the people. Protect the people from side effects, from interaction, but at the same time not to be too restrictive. Have an open mind. The key is to have an open mind and collaborate. When we are open-minded and we are ready to learn from different people and we work together and collaborate, and conferences like this bring us together, meet each other, learn from each other, work together, that is when we can make the integrative medicine for everyone come true. So we have last 1 minute, and in this 1 minute, I would first like to thank you all for being here. And with this beautiful energy, I want all of us to see if we can close our eyes and put into the universe that integrative medicine should come into life of each and every patient in a safe way, which does not harm the patient, which is going to benefit a lot of people, both with cancer, without cancer, worldwide, in a peaceful, safe, and in a scientific way. So if we can all close our eyes and spend the last 20 minutes we have, that will be great. And thank you very much for your listening. And thanks for having me here, Dr. Pfeiffer, and thanks all of you.